This is Radio Health Journal. I'm Nancy Benson. This week, caring for strangers. As one doctor puts it, it's good for the soul.
What love requires is the ability to believe that their experience of their life is as important as your own.
Life and death in the emergency room when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics, from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
This week on Viewpoints.
Strawberries are extremely labor-intensive, probably more than any other crop.
Why the strawberry industry is in trouble. Then,
it's hard for us, I think, to imagine what you can smell cancer. You can smell someone when their blood sugar's going low.
Why dogs may just be the key to early disease detection. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Paul Seward cares deeply about the welfare of complete strangers. For more than 50 years, it was his job as an ER doctor. But now, in retirement, he says we all need to make it our job, or our world will be in big trouble. It's one of the big lessons he's learned and shared in his book, Patient Care: Death and Life in the Emergency Room.
Basically, you love your kids, and you love your family, and you love your associates. But nowhere in our wiring is to love the people in the village 50 miles away, who are also hunter-gatherers, because you're never going to see them. You're never going to know them. But now we live in a world where most of the people we encounter on any given day are people we've never met before. And applying the instinctual need to love people is an act of choice in that situation. And yet, I'm convinced that if we cannot make that leap to taking the wiring that is useful with our families and friends and applying that to the world, our tenure on this planet will be rather short.
And it could end when we've hardly begun, according to astrophysicist Neil deGrasse Tyson. If a football field were a timeline of cosmic history, cavemen to now spans the thickness of a blade of grass in the end zone. Seward is hoping we can make that space a little bigger by choosing to care for the welfare of everyone.
Nobody does that perfectly, and I certainly don't. I fail miserably at this task on a daily basis, but I know it's the task, and I know that if I don't do it, it's not that I failed them, I failed me. I've made myself into a slightly less loving person than I want to be.
In one story, Seward describes seeing a patient enter the ER knowing immediately what was wrong with her.
In fact, it's so common, it's dangerous, because that's called packaging the patient, or deciding what a patient has on the basis of insufficient information because you know too much. So the usefulness of it is not that it lets you make a diagnosis. It lets you figure out what you need to explore first. And especially when it's something like meningococcal disease, you don't have a whole hell of a lot of time to get it right. And in fact, by the time a person who's already starting to be covered with petechiae arrives at the ER, it's probably too late, because things are starting to really fall apart in terms of internal homeostasis is the fancy word.
And then there was another patient where Seward had no idea what was wrong, only to be confronted with a curt, "Read my chart."
Yeah. She was wonderful. Oh, God. That, if you wanted a cure for humility, a cure for, something to make you humble, she was the lady. Because she is at the one side. On the one, she came in, and she was sick, and she came in because she needed a doctor. And at the same time, it's not merely that she thought she knew what she had. She did know what she had. She was a retired ER nurse, for God's sakes. And she'd been, and as I said, I was probably, when I was 10 years old and never heard of potassium, she was working hard in ER. She took responsibility for herself. A lot of patients don't do that. A lot of patients come in and say, doctor, what do I do? You tell me. And that's a harder problem to solve.
And even if they didn't have the answers, Seward appreciated patients who were invested in their own care.
If they come in and say, doctor, I think I have this, and I want you to tell me, but maybe I don't. And also I have a set of questions that I need to have answered. And I'm here to get your advice, but I'm not necessarily here to have you control my life. And in other words, I like patients who take responsibility for themselves. And at the same time, one of the ways they're taking responsibility is to correctly go to the ER. And by the way, anybody who wants to go to the ER and thinks they have something that needs to be in the ER is correct.
Every day, Seward says he asked himself the same question every ER doctor asks.
Is today the day I screw up? Is today the day something bad happens and it was my fault, etc.? That's always there. But when you're 50, well, something bad happened and I still did my best and I'm still a good ER doc. And it's part of the job to have bad things happen. And the job, if you can't endure that part of the job, then you can't do the job. But when I'm 75 and I miss something, which is actually what happened, which is why I quit. It did nothing, no bad consequence, but I made a small mistake, and I said, I wouldn't have made this mistake 10 years ago, and I have to stop now because of that. Because I'm now a person whose memory is not quite as good as it was, whose ability to multitask is not quite as good as it was. I have to quit.
But while you're caring for strangers, family is part of caring too. And being married to an ER doctor, as you can imagine, puts a strain on a relationship. Yet Seward has been married for 47 years.
I can't say it wasn't painful. I mean, a lot of times it was, and it's also, it's stressful sometimes when you're telling your family. I mean, I worked every single Christmas Eve. It was my favorite time to work, but that's not necessarily good for the home life. And I had to work sometime. I picked Christmas Eve. My theory was that if I worked Christmas Eve long enough, Tiny Tim would come in, and I would make sure the little kid didn't die. I'm married to a person who is very strong and very willing to share her feelings, especially to me, and that was very good for me.
And it's been good for the patients who were lucky enough to receive Seward's care on Christmas Eve and every other day. He says he wrote his book for all readers, but he especially had in mind those who work in the ER.
Because I wanted them to know how valuable they were and that it's okay to care about people and stuff. Yeah.
Paul Seward's book is called Patient Care, Death and Life in the Emergency Room, available now. You can learn more about all our guests by visiting our website at radiohealthjournal.org. Our writer-producer this week is Polly Hansen. Studio production by Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Today's consumers are choosing foods for specific health benefits. Heart health tops the list, according to a recent study conducted by the International Food Information Council. Certain whole foods, such as grapes, which contain over 1,600 natural plant compounds, may be the key. Registered dietitian Courtney Romano is the health advisor for the California Table Grape Commission.
A heart-healthy diet is rich in whole plant-based foods. A first step is to consume more vegetables and fruit, including grapes. Fresh grapes have hundreds of naturally occurring beneficial plant compounds, including antioxidants and other polyphenols. Research suggests that adding grapes to the diet every day helps support heart health in both men and women.
Heart-healthy grapes from California are in season from May through January. Grapes of all colors, red, green, and black, are a natural source of beneficial antioxidants and other polyphenols, which contribute to heart health. Visit grapesfromcalifornia.com for more information.
Paid non-attorney spokesperson paid for by the Sentinel Group. Attention military vets and current soldiers who served between 2002 to 2016. Have you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces? You may be entitled to compensation. 3M, the manufacturer of earplugs made for combat, recently paid the government $9.1 million to settle a False Claims Act case for knowingly selling these defective earplugs for over a decade. Specifically, the United States argued that the manufacturer knew their earplugs were too short for proper insertion insertion into users' ears and that the earplugs could loosen and therefore didn't perform properly or reduce noise the way they should have. If you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces, you need to choose the right legal team that has the experience, support staff, and resources to seek the most compensation for your injuries. Call the Sentinel Group now for more information and a free case review. Call 800-655-6458. 800-655-6458. That's 800-655-6458.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal.
Coming up next week on Radio Health Journal.
What we were seeing was sort of 5 to 10% reductions in these very important nutrients for human health.
The rise in atmospheric carbon dioxide. It makes crops grow faster, but there's a downside.
Then, should the U.S. join the many countries offering paid parental leave?
It's sad, but only 17% of workers here in the United States have the ability to access paid leave through their employers. And actually, even the lowest wage worker, that number goes down to 5%.
All that and more on Radio Health Journal.